Hello, my name is Kayla Erspamer from OHSU, and I'm grateful to be presenting the work I did with Dr. Reem Hassan at this year's Oregon Pediatric Society's virtual conference. The purpose of Bridging the Gap was to create and implement a session to teach pediatric to adult transition concepts to medical students. A recent clinical report on healthcare transition, which will now be referred to as HCT, reported over 80% of young adults, both with and without special healthcare needs, are not receiving transition care. Numerous studies have reported lack of transition care is associated with poor outcomes and adherence among young adults. Many barriers to transition care have been reported as well. One of these barriers is lack of provider knowledge regarding HCT. Although an immediate impact on patients and families is more likely with a resident and/or faculty HCT curriculum, we wanted to introduce medical students to HCT concepts so they are aware of the topic and will hopefully encourage their future residency programs to adopt a formal curriculum. Guided by the 6 core elements of HCT developed by Got Transition, we created a short and interactive session. By the end of the 1.5-hour virtual PowerPoint session, we wanted students to meet 4 objectives. 1, be able to define transition care. 2, describe the elements of a formal transition program. 3, identify barriers to transition care. And 4, map the transition process for a patient. Pre- and post-curriculum surveys were distributed. Additionally, students were asked to generate both a pre- and post-curriculum word cloud. A total of 40 students across 4 sessions completed the curriculum and assessments. By the end of the session, students had gained significant knowledge related to transition care. Post-session, 77.5% of students were able to define transition to others. 80% were able to explain the difference between pediatric and adult models of care, and 90% of students correctly identified when transition care should be introduced. This is compared to 7.5, 7.5, and 17.5% pre-curriculum, respectively. Additionally, 97.5% of students felt the curriculum met all objectives, 85% said they would recommend the session to other students, and 95% said they were interested in learning more about transition care. The inclusion of a pre- and post-curriculum word cloud was to identify shifts in students' associations with HCT after learning more about the topic. Continuity, important, and communication were among the most frequent associations for each word cloud. However, more students included important and communication post-curriculum. Interesting additions post-curriculum include necessary, essential, and undervalued. We may extrapolate from these additions that students now understand how critical HCT is to young adults. Students were also able to identify the main barriers to transition care by the end of the session. Patient and family barriers included strong relationship with their pediatrician, lack of continuity, and lack of trust regarding adult providers and the adult care model. Provider barriers to transition care included strong relations with their patients, ability of the patient to navigate healthcare, lack of adult care providers' knowledge, and lack of formal transition programs. In summary, 4 HCT objectives can be met in a short session where medical students can gain significant knowledge. Medical students are interested in learning more about HCT, and the majority would recommend this curriculum to others. This curriculum is an excellent prototype for what can be instituted at other institutions, not only for medical students, but also for residents and faculty. The limitations of our work include the small sample size and the summative free text data analysis. Long-term impact and retention of concepts will be determined with a 12-month follow-up survey, and future studies will include residents and faculty. Thank you.